Relieving sciatica pain at home. That sharp, shooting pain that travels down the back of your leg, better known as sciatica, is not subtle. Sciatica, an affliction that affects up to 40% of people at some point in their lives, can often be addressed at home with some simple, tried-and-true techniques. Symptoms can vary from annoying and nagging to total inability to ambulate, walk. Here's a closer look at what might be causing the pain, and some ways to manage it on your own. Causes of sciatica. The most common cause of sciatic pain is a herniated disc. According to Dr. Mirza, this happens when the jelly-like center of an intervertebral disc pushes through the outer ring of the disc, or causes this ring to bulge, putting pressure onto the sciatic nerve, technically called the L5/S1 nerve because of where it's located on the spine. In addition to a herniated disc, other issues can also trigger sciatica, says Dr. Mirza. These include arthritis, bone spurs, aka bone overgrowth, cysts or tumors, disc tears and degeneration, nerve damage due to diabetes, torn or thickened ligaments, ligamentum hypertrophy. The way we move and carry ourselves can also exacerbate the root causes of sciatica. Twisting, bending, or even coughing or sneezing can worsen sciatica pain. Who's most at risk for sciatica? While almost anyone can develop sciatica at some point in their lifetime, there are a few factors that increase your risk for experiencing this pain. Among the older group, in contrast, sciatica tends to be caused by the buildup of bone spurs, thicker ligaments, and arthritis onto the nerve, stuff that develops over decades of gravity, force and stress. A study in the British Medical Journal highlighted other potential risk factors, including smoking, obesity, and mental stress, as well as occupational factors such as jobs with strenuous physical activity, lifting, especially while bending and twisting, and extended sitting and driving. Symptoms of sciatica include pain from your lower back or butt and extending down one leg. The pain may be dull, aching, shooting, or burning, and it can sometimes feel like an electric shock. Feelings of muscle weakness or altered reflexes. Numbness or pins and needles, tingling sensation. Depending on the location of the compressed nerve, symptoms may get worsened when coughing or sneezing, bending over, lifting objects, twisting, sitting down, or sitting for a long time. It usually only affects one side of the body. In most people suffering from sciatica, the symptoms completely resolve or dramatically diminish in 2 to 6 weeks. How to find relief at home. There is a silver lining to sciatica pain. Often you can avoid medical intervention and treat the issue on your own, says KIST. The following practices can help relieve the discomfort. Over-the-counter medications. Taking an analgesic such as paracetamol or non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen and naproxen is a good first step at helping to control the pain and reduce inflammation. Ice packs or heat. Applying heat or ice directly on the muscle can relax or cool whatever is spasming or inflamed and reduce muscle swelling. Try applying an ice pack to the area of discomfort for 15 minutes once an hour, then apply heat for 15 minutes every 2 to 3 hours. Moderate activity. One of the most important things to do when you have an onset of sciatica is to remain as active as possible, to avoid your muscles getting stiffer or spasming. This doesn't mean pushing through pain, but if you are able, continue to move, walk, and resume other normal activities. However, avoid heavy lifting, bending, and twisting. Range of motion exercise. See next video on actual exercises and position and movements. Start by gently putting the affected leg through its range of motion. Even if a patient is in a major back flare, I have them bend and straighten out their hip and knee and move their ankles, he says. Physical therapists call this nerve gliding. You're gliding the nerve back and forth, because it's pinched and you're just getting it moving. When a nerve is irritated, it's not able to glide as easily through the surrounding sheath. This gentle movement can help restore mobility. Herbs to relieve sciatica pain naturally. Several ancient subcontinent, Pakistani herbs have been found to be beneficial in reducing sciatica pain. Some of the common ones are: 1. Garlic possesses anti-inflammatory properties and has been effective in relieving sciatica pain. To reap its benefits, eat 1 to 2 garlic cloves with warm water or milk in the morning every day, as it can go a long way in fighting the pain. 2. Bitter chamomile herb that contains an essential oil comprising of complex compounds such as chamazoline, farnesene, bisabolol, and flavonoids, plant acids and other biochemical derivatives. These compounds are known for their potent antioxidant, anti-inflammatory and pain-relieving properties. Chamomile flowers are compressed to extract oil, which is widely used as an essential oil to relieve pain and inflammation. Mix a few drops of chamomile oil with a carrier oil such as olive oil or coconut oil and gently massage on the affected area. Do this 2 to 3 times a day for a few days to relieve sciatica pain. 3. Aloe vera is a rich source of glycosides such as aloin, which have powerful antioxidant and anti-inflammatory properties. These properties are responsible for providing relief from pain and reducing the risk of inflammation. Take aloe vera pulp, powder, gel and mix with 1–2 pinch turmeric. Apply directly on the affected area once or twice a day. This is known to relieve the symptoms of sciatica effectively. 4. Nutmeg. Known for its amazing flavor and taste, nutmeg is a very popular Pakistani spice which helps in relaxing the muscles and inducing sleep. The spice is rich source of saponins and essential oil which is known as myristicin that helps to relieve rheumatic pain, neuralgia, and sciatica pain. For pain relief, take coarsely powdered nutmeg powder fried in sesame oil until it turns brown completely. This oil can be applied externally to relieve severe pain. Alternatively, you can take 2–5 drops of nutmeg oil, mix with sesame or coconut oil and massage gently on the affected area once or twice a day to manage joint pain. 5. Valerian root is enriched with relaxant properties that help relax the muscles and provide relief. The herb is a rich source of volatile oils which aids in relieving chronic muscle and nerve pain. The analgesic properties of this root are responsible for easing pain and also providing quick relief. You can choose to take valerian in the form of a supplement 3 times a day for a week or opt for valerian tea. To make the tea, steep 1/4 to 1/2 teaspoon of valerian root in water, strain, cool and drink. You may choose to add honey to make it palatable. When to see a doctor. Though sciatica usually goes away relatively quickly, certain symptoms and situations require more immediate medical attention. Bilateral, both sides, leg symptoms of pain, numbness, or tingling. Continuing inability to go to work. Difficulty walking due to decreased coordination. Inability to initiate urine or completely void the bladder entirely. Incontinence of bladder or bowels. Numbness in the groin or saddle region. Pain at night that doesn't change regardless of changing positions. Pain that does not decrease in intensity after a week or 2. Progressive weakness in the legs. Preventing future sciatica attacks. Research shows that if you don't address some of the underlying issues such as a herniated disc or arthritis, sciatica is likely to recur. But there are things you can do to reduce your odds of feeling the pain again. Stay active. Don't stand in one place or sit for too long. Both put excessive, ongoing pressure on the spine. That means getting up from your chair frequently and gently stretching or move around, especially if you have a desk job. If you have to sit for 8 hours a day, get a standing desk, or set your phone timer to go off every 45 to 60 minutes, counsels Dr. Kim. When that pings, get up, walk around a little bit, take a break, and change your position. Move smart. Avoid activities and movements that can cause sciatica. Once you know you are prone to the condition, avoid lifting excessive weight and steer clear of activities that involve a lot of bending or heavy twisting of the lower back. Follow a healthy lifestyle. Both smoking and obesity are known to trigger sciatica. If you do smoke, there's no time like the present to quit. Find free resources from the Centers for Disease Control and Prevention. In addition, following a balanced diet and staying active can help keep you at a healthy weight to reduce the extra pressure on your spine that can initiate or exacerbate sciatica. Mind your posture. Since sciatica stems from your spine, it makes sense that good posture can also play a big part in reducing its likelihood. When your spine is out of alignment, Whether you're tilting to one side, or leaning forward or backward excessively, back problems and sciatica are more likely to occur, says Dr. Kim. A few cues to keep in mind. Bend your knees and lift heavy objects from your legs and avoid bending forward. Don't hunch over. Keep your spine in a neutral alignment when walking or sitting, with your shoulders pulled back and chin tucked slightly. Strengthen your core and improve your flexibility. Strong legs and abdominal muscles support and take the pressure off your spine, so regularly incorporate exercises to target these muscles. Similarly, improving your flexibility with activities such as stretching, yoga, or Pilates can help keep your spinal muscles and hip muscles from becoming pinched or contracted. One British study found participants with low back pain, including those who suffered from sciatica, who did a series of yoga classes had significantly less pain after 3 months than a control group. Talk to your doctor or a physical therapist about which exercises or stretches might be best for you. Use supportive devices. There's no shortage of products on the market that are promoted to reduce back pain. In the case of preventing sciatica, lumbar pillows or ergonomic chairs may prove helpful. Lumbar pillows help maintain the neutral arch of the back, decreasing the stretch on the discs and the nerves, explains Kirst. With an ergonomic chair, look for one that will allow you to position the seat at the right height for you, so that both feet are on the ground and your hips, knees, and ankles are angled about 90 degrees. Whatever chair, pillow, or bed gets you into neutral alignment is probably the best choice for you.